The next speaker, Dr. Ayman Zyada, will talk us about the our brachio-axillary grafts, a reliable solution for patients with difficult vascular access, a systematic review, and meta-analysis. Go ahead, please.
Thank you so much. Brachio-axillary graft. Is that new? No. Why we are focusing actually on brachio-axillary graft? It might be kind of rare type of dialysis access, but due to rising population of end-stage renal disease people and limited EV fistula options sometimes, plus poor outcome of most of arteriovenous graft, there is a promising results coming with the outcome of brachio-axillary grafts. What we are doing is trying to arrange for a meta-analysis to assess the outcome of the brachio-axillary graft. And there are new technology regarding the graft as well. So what we have done is a Prisma chart rules for brachio-axillary graft meta-analysis. We picked up around 97 studies filtered with total of 858 participants throughout the whole graft or throughout the whole studies. We picked up the studies who included patients with brachio-axillary grafts and reported a follow-up duration and the outcome in matter of patency. So what was the outcome? Basically, this is the list of the patients and the patency rate among all studies included. These were around 48% 7 males with median follow-up of around year and a half. And the patency rate actually was 52.6%. And if we look at the complication rate, as expected, most common complication would be infection with 2.8, seal syndrome 2.2, bleeding 0.5, pseudoaneurysm 0.35, and neurobraxia or nerve injury less than 0.2. What does this mean? Try to save time for lots of statistical tests and complexity, and I'll summarize our meta-analysis outcome in one sentence, and that would be half of brachio-axillary graft might block in 1.5 years. Is that a good number or bad number? Then the question is, does it worse still doing the brachio-axillary graft despite this outcome? That the meta-analysis doesn't tell us if it works or not. It tells us just frank numbers. But if we still look at the literature, we'll find out the EV fistula is still our first option and with more promising results. However, it does not suit all of our patients with venous complexity. Brachio-axillary graft is actually better than other types of loop graft. For example, there are lots of other literature reporting brachial graft, which is a loop graft, around 40% patency rate in 1 year. So brachio-axillary graft has a higher hand in this case. Finally, brachio-axillary graft, some structure or some studies report its comparable outcome with even brachiobasilic transposition fistula. I'll conclude very quickly what we think when AV fistula is not suitable. It might be advisable to consider brachio-axillary graft, given to it's relatively safe and has reasonable outcome. Of course, the meta-analysis gives us, as I mentioned, frank numbers, but it should be individualized patient's decision based on the outcome we know from this literature. That's all I have for you today, and thank you so much.
Thank you very much, Dr. Ayman, for this precise presentation. Now we can open the discussion for the floor for our speakers. Any question for our speakers? Professor Mossad, please go ahead.